The endovascular aneurysm repair, or EVAR for short, is a life-saving and preventative surgery that repairs an aortic aneurysm. Every year, many patients have the EVAR surgery. This movie will explain how EVAR works, what the risks and complications are, and what you can expect from treatment. In the EVAR procedure, a short tube made of flexible metal and synthetic fabric, called a stent graft, is placed into your aorta. The graft attaches to the walls of the aorta, sealing off the aneurysm from inside. Blood can then flow through the graft and not press against the weakened aortic walls. This prevents the aneurysm from bursting. The stent graft is usually inserted through the arteries at the top of your leg. Less often, it may be inserted through your arm. Your surgeon may get to these arteries by inserting a needle through your skin or making a small cut in your upper leg. Your surgeon will use a guide wire to place a thin plastic tube into the artery, up into the aorta. The stent graft will then be fed into the artery through this tube and placed between the two healthy portions of the aorta. This is where the graft will open. And be molded and sealed to the aneurysm. The surgeon makes sure the graft is in the right place using X-ray imaging. It also allows the surgeon to check for any leaks around the graft or outside the aneurysm. The graft will keep the aneurysm from growing and may even cause the aneurysm to shrink over time. It is important to return for ultrasound or CT scans at least once a year to check for a condition called endoflow. This is the unexpected flow of blood into the aneurysm around the outside of the stent graft. Although endoflow is common and occurs in 10 to 30% of surgeries, only a small percentage of cases may need treatment. In most patients, endoflow from small leaks does not add much pressure to the aneurysm and only needs to be checked on regularly. Endoflow has no symptoms and can be found with ultrasound or CT scans. Your life after EVAR can go back to normal. Most patients regain their full energy and can get back to their normal activities within 1 to 2 weeks. The graft will need lifelong checkups and will generally require routine scans once a year. In the first year after surgery, you may need more than one scan. These scans check the position of the graft, make sure the aneurysm is stable, and check for endoflow or other problems. Regular scans can identify problems early. The EVAR procedure is a preventative, life-saving surgery that uses a graft to seal off the aneurysm and prevent it from leaking. Like any other long-term health problem, the aneurysm with its EVAR will need to be checked by your doctor on a regular basis. It is a relatively quick and minimally invasive procedure that allows most patients to return to their normal activities within the week. You will be able to return to your daily life with EVAR.